Assalamu alaikum. Good afternoon, everyone. I'm Khalid Shamar. I'm a second-year resident in King Saud University. The case is conjunctival swelling that presented in the emergency of a foreigner. He's a 44-year-old male. He's not known to have any medical illnesses. He presented with right lower swelling for 1 month. The mass was painless and progressing in size. He did not have any history of tearing, discharge, redness, involvement of the globe in change in vision or function. He had a history of ocular mass excision done in his home country 5 years prior to his presentation, but he did not know the diagnosis. The function and the integrity of the globe was intact, apart from the lower lid mass, which measured 2 centimeters by 2 centimeters. It was painless, non-tender, reddish in color, smooth surface, soft and cystic. With transdenomination, it showed dim content. The lower lid tarsus was displayed inferiorly, and the right lower punctum was slit-like in shape. And this is the mass that was involving the lower conjunctiva. Our clinical diagnosis was going with xanthogranuloma or vascular lesions, cystic lesions, or inflammatory lesions. So he underwent excision in the minor treatment room under local anesthesia. The lesion was extending and destructing the lower canalicular system. Probing showed patent nasolacrimal duct, so mini Minoka was inserted. Under the microscope, the histopathology showed round plasma cells, binoculated with a few giant cells. And immunohistochemistry staining showed expression of CD138, CD38, CD79A, and kappa light chains. It was negative for lambda light chains, IgG4, CD3, CD56, and CD20. So the pathological diagnosis supported plasmacytoma. Extramedullary plasmacytoma is a plasma cell tumor without osseous involvement. It is most commonly present in upper respiratory tract, GIT, and lymph nodes. Orbital manifestations of the lesion is rare, and conjunctival involvement is very unusual, with 5 cases only reported in the English literature. It can be found in patients with history of multiple myeloma or where the diagnosis has not been established yet. However, according to the National Comprehensive Cancer Network, the new criteria of diagnosis supports that multiple myeloma can be diagnosed with the presence of extramedullary plasmacytoma. Theuro and his colleagues evaluated 30 patients with orbital plasmacytoma.
I think I'm going to have to stop you. I'm sorry. Sure, your time is up. Okay.
So my main question, if anyone has faced such lesion in the orbit, and was it associated with multiple myeloma before or after the diagnosis?
Yeah, so somewhere around 4 years back, we have presented the largest series of orbital plasmacytomas, and almost 30% of them did not, to begin with, had multiple myeloma. So systemic involvement to begin with is not a necessary thing. The second thing is that I think the lower canaliculus, the presumption that it destroyed the lower canaliculus would not be right, because you wouldn't have been able to place a stent otherwise. So it's limited to the conjunctiva overlying the canaliculus. Most of the time it does not, it's not that aggressive to infiltrate, looking at the consistency of those things. So my feeling is that it has not infiltrated the lower canaliculus, but it was in close association for which you were able to place a Monoga stent.
Yeah, I believe that these patients are at continued risk for multiple myeloma, so obviously you're going to keep them under surveillance for that.
Yeah.
I have had a couple patients, I think, with solitary lesions similar to yourself. I know that one has progressed to multiple myeloma. I'm unsure of the other one.
Okay, thank you very much. Thanks.